welcome once again to healthcarehoaxvideos.com. I am Janet Cimorelli here with Dr. Herb Slavin, and this week we're talking about low-dose naltrexone and the many different applications that it may have for your good health. So what we're going to talk about is how to save yourself with low-dose naltrexone. Dr. Slavin, what do you have to share with our listeners and viewers that they can actually help themselves with LDN?
Well, when a patient comes into the office with a complaint, and if they don't have a complaint, they come into the office to see how well they're doing. We do lab work to see if everything looks good. And if, say, they have a complaint or there's something wrong with the lab work, you look to see what they're doing to cause that problem, and then remove that, and they get better. But there are times when they may have a complaint, you do all the lab work, and you do not see anything out of range, abnormal. And then you have to say, what could be going on? Now, this is a very common occurrence in medicine. And what mainstream medicine's approach to this is to put patients on antidepressants. You know, when they don't know what's going on, oh, you know, it's all in your head. You know, the lab work is normal, so it must be all in your head. Take an antidepressant. That's what they like to do. You've seen that, right?
I have seen that over and over and over again in a very unfortunate circumstance. So I'll kind of refer to something that is not necessarily recognized by mainstream medicine, fibromyalgia and the systemic pain that people experience with fibromyalgia. But mainstream medicine doesn't necessarily have any tests that they are going to use to evaluate the pain in a fibromyalgia patient. They might not have something to actually pinpoint where they need to do the pain relief. They have anti-inflammatories, but those anti-inflammatories come with side effects.
Exactly. So if you just treat the symptom, you'll never get better until you remove the underlying cause. And I was thinking about that today, knowing you'd ask a question like that. And the analogy I came up with is, let's say you have a nail in your tire. You can keep filling your tire up with air constantly, but it'll never stop. And that's what mainstream medicine is about. Refilling those prescriptions month after month, but you're never going to get well because they haven't removed the underlying cause of the problem. So how do you... Now, sometimes the underlying cause is something external. You may be eating the wrong food, you may be exposed to environmental toxins, or you may be under a lot of stress. And all those eventually can lead to dysfunction in your body. So now you got to think about how can we make the body function better? And that's where low-dose naltrexone comes in. And the interesting thing about low-dose naltrexone, and another treatment that we use, ultraviolet blood treatment, is that the conditions that they're effective against pretty much overlap each other. You see cancer, neurodegenerative diseases, autoimmune diseases. They're both effective for those conditions. So then you have to think, well, what are these drugs, in the case of low-dose naltrexone, or what is ultraviolet blood therapy doing? It's going after infections in your body, primarily. In the case of ultraviolet blood treatment, the ultraviolet rays can kill infections. In the case of low-dose naltrexone, it's improving the function of your immune system so it can go after infections. So all those conditions, the cancers, the neurodegenerative diseases, the autoimmune diseases, the fact that these treatments are effective suggests that there's an infectious component to all these conditions, which mainstream medicine hasn't acknowledged.
It's really interesting because you think about this substance that's affordable, no side effects, and is very effective. Does it work for everyone?
I don't think you can say it works for everyone. Probably the reason for that is that there may be other problems going on simultaneously, so you have to really get both under control. But assuming you get all the other issues under control, and the low-dose naltrexone has been shown to be very effective for a lot of conditions. It really is amazing. In fact, as the word about low-dose naltrexone gets out to more and more people, people are beginning to take it as a preventive rather than as a treatment for some kind of condition.
Excellent, excellent information. You've been watching healthcarehoaxvideos.com, and remember, when you go to healthcarehoaxvideos.com, remember to like us, to share us, and to subscribe so that you'll get a notification when the next video is posted. And tune in again when we're going to be talking about exactly how low-dose naltrexone will work for you. Thanks for watching.